Good morning, everyone. My name is Annica Aguzzi. I go by Annie. I am currently an MSPH candidate at the University of Utah Division of Public Health. And my supervisor and also co-author of this narrative review is Tejandra Pal Singh. And as the doctor just introduced me very correctly, my research revolves around traditional Tibetan medicine in the prevention of the treatment of COVID-19 in India, where Western medicine is not readily available. I have no relationships to disclose, and I should warn you that there will be several QR codes. There is a QR code where I share my entire presentation on demand view for you to review, and if you have any questions, my contact information will also be at the end of this presentation, as well as the end of the video that I share with you in the QR code. So let's get on to it. So the purpose of this review is to evaluate the findings related to the use of Ayush measures to prevent and monitor the transmission of SARS-CoV-2 in India, where Western medicine is not readily available. Ayush is an acronym that stands, as you probably most of you know, Ayurveda, Yoga, Unani, sowa, rigpa, homeopathy, and the factors that we had in mind for this review were two essentially. The first one had to do with the traditional preparation used during the COVID-19 pandemic in India in our particular area of interest, which was the Spiti Valley and the Ladakh area, and how they were used during this time. And the second factor that we looked at was the monitoring of access to traditional medicine in underserved areas of India. So this is the QR code that I was talking to you about. Feel free to scan it so that you can review this presentation in case I missed something while talking to you today. This is an ongoing work that Dr. Singh and I have been doing in the Spiti Valley of India. These are areas in the northern India, so the Himalayan regions, where people suffer great social determinants of health. And as a result, the geographical challenges also impede access to Western medicine facilities. This is the area in question that I was talking to you about. We have Ladakh here and the Spiti Valley around this area. So the background to this research is that the government of India wanted to integrate the traditional medicine into their new health policy. And the reason why they did that is because the Western medicine for underserved communities of India was too expensive. The high out-of-pocket costs were unaffordable for most of the individuals in areas in underserved communities, and also because there was a limited or scattered availability of Western facilities. And for this reason, it has been a problem of the Indian government to deal with fragmented healthcare. Tibetan medicine is preferred by individuals in these areas over Western medicine because, as I said, the limited availability of Western healthcare facilities, the high cost of those facilities, the social determinants of health associated with individuals living in these areas, as well as poor health literacy, and I would say, mistrust of modernized means that seem unfamiliar to them. And all of that has contributed to a fragmented healthcare, which the Indian government had tried to remedy by integrating the two Western and traditional medicine together in the new Indian health policy. Now, the problem is that the COVID-19 pandemic occurred in the context of this fragmentation. And as a result of that, there's a speculation that there have been more cases that there should have been, and definitely more deaths than there should have been. This is what we know about the COVID-19 pandemic in India. As of May 13th, 2022, there were reports to the WHO that over 43,000 confirmed cases and over 520,000 deaths. And it is believed that this is an underestimation of the problem. And also, I shall have you noted that as of May 13, 2022, there were 6 active cases in the region of Ladakh. Ladakh is right here, so we're talking about northern India. Again, this is our area of interest. There were 54 cases in the Kashmir areas, 61 cases in the Himachal Pradesh. And I shall have you noted that the regions in yellow are the ones that have the lowest number of active cases versus the region in red, and Burgundy, which seem to have an increase in active cases. And I should also have you note that the regions in yellow, particularly in the northern area, are the ones that seem to be seeking actively traditional medicine versus Western medicine. So what we also know is that it is widely acknowledged in literature that natural products, the medicinal plants contained in these herbal formulations that the Ministry of Ayush has promoted during this time of COVID-19 in those underserved areas, those medicinal plants have actually potential antiviral effects, and they have been extensively studied. A very prominent case was the case of HIV-1. There have been a number of medicinal plants that have been studied in the case of HIV-1 to see if we could reverse HIV-1 latency in vitro, and literature has proven efficacy in silico in vitro of HIV-1 latency reversal. This is a study that I was part of just last year, where we were looking at organic compounds extracted from medicinal plants from the genus Euphorbia. And we've seen that diterpenoids and several ingenols, as well as flavonoids, they seem to be able, in different degrees, to inhibit HIV-1 reverse transcriptase, as well as produce HIV-1 latency reversal. We created a database with 9 active plants from the Euphorbia genus that you can feel free to scan as well. I'm sorry, I know I'm throwing a lot of information at you all at one time, and but we did have we cataloged these plants with their traditional use, as well as their potential antiviral potential and anti-HIV activity. The same type of work has been done in literature against SARS-CoV-2 in recent times, particularly Licorice radiata, and they extracted phenolic compounds from Licorice radiata and other medicinal plants. And there have been several examples in literature that effectively proves that there is different degrees of anti-SARS-CoV-2 activity as well. And for this narrative review, we sought to look at the publications that were of interest to us, that would discuss COVID-19 management with traditional medicine in the territories of interest to us. So we were looking at the Ladakh and Spiti Valley area, so the northern Himalayan regions, Indian regions, the Himalayan regions of India. So you will see that one aspect was essentially the COVID-19 management of with traditional medicine, and the other aspect was the COVID-19 surveillance and monitoring and surveillance. And the interesting thing about that is that the Ministry of Ayush in India has developed a smartphone application, an MOA app, that essentially collected data from over 7,000 people, and these 7,000 people will report daily about their COVID-19 symptoms, as well as whether they used Ayush-based measures or not, and whether they tested positive or not, and what benefits the traditional preparations have had for them. And obviously the narrative pool was a little limited. I'm going to move this a little bit to the right. I hope you can see we have 41 publications. There are a number of publications, obviously, on Ayurveda, Siddha, Sowa, Rigpa, Unani, and so on and so forth. But you must understand that we were tying this to the regions of interest, and in particular, in conjunction with the new Indian health policy. We wanted to see how the new Indian health policy was succeeding in those areas or not, and that is something that we're still in the phase of determination. And so we had to exclude, for example, traditional Chinese medicine or traditional or Tibet, Nepal areas. Because they were actually out of our scope of this review. And the results for this proved that the publications that we selected did discuss indeed COVID-19 management. They mentioned immune boosting and preventative measures, and also discussed the COVID-19 monitoring and surveillance. And this is what we found that's interesting. So I'm sure a lot of you are going to be familiar with these. These are Ayurvedic medicine preparations. Guduchi, Amla, and Haridra. They were promoted by the Ministry of Ayush during this time of COVID-19 so that the people of underserved communities could keep themselves safe. Now, Guduchi, Amla, and Haridra are none other than essentially the medicinal plants that are contained there, which are Tinospora cordifolia and Blica officinalis, Cucumalo. And these plants have been extensively studied. The organic compounds in these plants have been extracted. And if you pay attention, we have diterpenoids here. Once more, diterpenoids have proven to have antiviral potential in vitro and in silico. And these plants have proven to restore respiratory health, improve innate immunity, have anti-inflammatory activity, antioxidant activity, antiviral activity. And these are essentially the potential benefits of this Ayurvedic preparation that were used during the COVID-19 times by the Ministry of Ayush. The tools are Tulasi and Ashwagandha. And ashwagandha is a very well-known Ayurvedic preparation that contains the medicinal plant Withania somnifera. And Withania somnifera, once more, has been extensively studied in literature. The organic compounds have been extracted from Withania somnifera. And there is actually a recent study that proves that Withania somnifera shows anti-SARS-CoV-2 activity in different degrees, and there is and that's an interesting study from Sri et al. Moreover, Ayush Kawat and Ayush 64 are other preparations that were used during the COVID-19 pandemic, and Ayush 64 in particular has been the subject of ongoing clinical trials from which we hope to get data soon. And the effects of Ayush 64 on people have proven to alleviate respiratory symptoms from COVID-19. One other preparation was Kada, and Kada also is an Ayurvedic preparation known for its ability to treat an array of respiratory symptoms, and has been recently studied in relation to SARS-CoV-2, and it looks as though it can interact and in different stages of the infection caused by the SARS-CoV-2 virus. One last word in the monitoring, you see here, I did tell you in the beginning that they tracked the use of traditional medicine through the MOA app. And so they surveyed over 7,000 people. And at the end of the survey, they obviously conducted an analysis. And the one that I'm showing here to you is a logistic regression analysis where the outcome variable, dichotomous variable, is COVID-19, yes or no, based on the duration of the Ayush measures, whether it was 30 days, more than 30 days, or less than 30 days, and they adjusted that for comorbidities, so pre-existing conditions, as well as risk categories. And the results of the logistic regression analysis revealed that individuals who were using Ayush measures for less than 30 days were 1.52 times more likely to test positive for COVID-19 versus those who have used Ayush measures for more than 30 days. I have another model for you. And this logistic regression model wanted to essentially predict COVID-19 symptoms. So the outcome variable, dichotomous variable, is COVID-19 symptoms, yes or no, based on the use of use-based measures, yes or no, and adjusting for comorbidities and risk categories. And the results of these logistic regression models showed that those who were not using use-based measures were 4.01 times more likely to experience COVID-19 symptoms than those who had indeed used use-based measures. And when adjusted for comorbidities, the odds ratio gave a 3.48 times more likely to have experiencing COVID-19 symptoms versus those, again, once more, who have used Ayush-based measures. So to conclude, we feel that this type of work is important because it allows us to explore these, what we feel are somewhat underrepresented systems of medicine, and we would like to open the door to a conversation about translational initiatives and more discovery about these traditional medicine systems. And we would also invite you, and I'm sure you all agree with me, to have an open mind in the sense that we can all learn from individuals in underserved communities that cannot or are not able to access Western medicine, and therefore have used these systems of medicine, and they have kept themselves safe through these systems of medicine. This is a lesson for all of us. And so this narrative review really is not just about our area of interest, but it is for the benefit of humanity as a whole, because whatever we may find in the future in terms of translational initiatives will probably have definitive answers, not just for SARS-CoV-2, but also for HIV-1 in reversing its latency. And this is all, and these are my people, these are my acknowledgements. I'm very thankful for them. And once more, whoops, this is me. Oh, it keeps bouncing up and down. And my contact information is there once more. My name is Annica Aguzzi. I go by Annie, and I am from the University of Utah Department, School of Medicine, Division of Public Health. I report to Tejinder Pal Singh. And the QR code, again, it is the recorded version of this presentation. And with that, I leave you. I will stop the sharing. If you have any questions, I'll take your questions. Otherwise, I'll just hand it on to the next presenter.